ngayon sa isa naman pong Zoom lecture brought to you by PSPHP. Ang Philippine Society for Public Health Physicians po ay this past few weeks ay nagdadaos ng mga Zoom lectures para po makapacitate po yung ating mga health workers, especially po doon sa ating mga frontline workers sa ating mga community. Nagkakaroon po tayong lectures regarding dito sa COVID-19 response po natin, and isa po sa kailangan natin tingnan rin is kung paano natin i-handle yung ating mga mild cases po natin na COVID. So, for today, nandito po si Dr. Rosell-Ubial para po pag-usapan yung ating ang topic for today po natin is paano po yung pagse-set up ng mild COVID isolation facility. Specifically, yung example nito is yung Quezon Institute. So I'll also want to recognize yung president po ng PSPHP na nandito po ngayon, si Dr. Lester Geroy. So, sir, nandito po siya. And so, simulan na po natin. I-introduce po ang ating moderator po natin ngayon. May po siya ng IHO at sa PSPHP, Dr. Mix Dorotan. Doc?
Okay. Maraming salamat, GR. No? Magandang hapon po sa lahat. No? And Secretary Pao and Sir Jimmy and the others. No? It has been 3 weeks since the enhanced community quarantine, and I hope everyone is safe and healthy. We also want to thank everyone who has been part of this fight against COVID-19, and that is all of us. Each of us have a role to play. The hospital is our last line of defense, and we must protect it at all costs. So we should bring the fight to the community, and we must fight as a community. Ending this week's PSPHP lecture series on COVID-19, we are very fortunate to listen to a former Department of Health Secretary on her experience in setting up a treatment facility at the Quezon Institute. Let me briefly introduce our speaker. Dr. Ubial had led an extensive career in public health service for 29 years with selfless devotion and a passion under 13 health secretaries. She started as a volunteer health worker in Mindanao, rising up from the ranks to the Secretary of Health. Her vast experience in the country's health conditions have led her to be the leader and champion of Kalusugang Pangkalahatan, with advocacies in women and children's health, breastfeeding, blood donation, tobacco control, healthy lifestyle, and mental health, among others. Her extensive career in the office had led her to numerous notable designations, such as a founding program manager of the Sentrong Sigla movement of the Quality Assurance Program of the Department of Health, and the founding manager of the Women's Health and Development Program in the DOH. With her expertise in women's health, she was also named as a DOH Gender and Development Focal Person. Additionally, she gained prominence as a chairperson of the Red Orchid Awards, or the search for 100% tobacco-free environment for national and local government offices, hospitals, and government organizations. She was once designated as head of the Department of Health's Integrity Development Committee and of the Task Force for Performance Governance System and the Social Dialogue. She has worked under regional offices of Sacsargen, Western Visayas, the Zamboanga Peninsula, and the Davao region. Her designations have also allowed her to reach different regions of the country, such as the typhoon-devastated Eastern Visayas and the geographically isolated areas of Palawan, Sulu, Tawi-Tawi, and Basilan. Dr. Ubial is an ardent believer that health is a multi-sectoral discipline. She believes that with enough government and private support, universal health care will be achieved. Together with her experience and work ethics, she believes that health is everyone's concern and is pushing this country's poor and marginalized to better health outcomes, as she vigorously chants all for health towards health for all. To also have joined us today, please welcome former Secretary Doc Pao Ubial. Ma'am?
Thank you for that kind introduction. Sabi ko maikli lang. But I would like to start my uh, brief presentation with the PowerPoint presentation. So we're now looking at the Quezon Institute as one of the model of the DOH isolation facilities for mild or asymptomatic COVID patients, meaning that these patients are already tested positive and they actually were uh, reviewed if they can go on home quarantine, but because of the situation in their houses, uh, is my audio okay?
Yes, ma'am. It's clear po.
Okay, okay. So because of the situation in their houses, which might not be ideal that they go on home quarantine. So the concept of building up a mild COVID isolation facility was made. And right now, many LGUs are starting to put up their own mild COVID isolation facilities. But I don't know if how to go about really standardizing these facilities, because it's the first time that we will be having such facility. Next slide. Hindi ko magalaw. Oo. So this is the outline of my presentation. Probably just breeze through the milestones and situational analysis. I'll go directly to the organizational structure, roles and responsibilities, process flow, and SOPs. Next. So we all know that this pandemic started in Wuhan, China, and then it was differentiated on January 7, 2020. The first COVID case in the Philippines was identified on January 21, 2020, and so on. Next slide. Hindi ko na alam nyo na yan. And then it was declared by WHO as a pandemic in March 2020, and the president declared it a red alert sub-level 2 and declared community quarantine for the entire Metro Manila first, then the entire Luzon by March 16. Next slide. So what happened is that it took, yung last bullet na lang, it took 3 months to reach the first 100,000 cases and only 12 days to reach the next 100,000, only 4 days to reach the next 100,000. And by, this was March 25, it took 1 day to reach the next 100,000. And almost every day, we have more than 100,000 cases, so that by April 2, today, we have more than 800,000 cases. Next slide. So we know that COVID is really a very annexed, okay, this is the one. It's very contagious. And here in the Philippines, we see an increasing number of cases starting on March 8, where we had 35. And on March 31, we had 2,048 confirmed cases. And from only about 3 deaths in March 8, we're now to 88 deaths. Next slide. So we know the epidemiology of this disease is that 81% of cases are mostly mild and asymptomatic. Severe disease or severe pneumonia happens in 14% of cases, and very severe disease, which will need ICU or intubation in 5% of the cases. Most of the symptoms are presenting with fever, 88%, dry cough, 67%, fatigue, and dyspnea. Other symptoms are sore throat, rhinorrhea, headache, and diarrhea. Comorbidities include diabetes, hypertension, kidney disease, heart disease, and asthma. There is a need to identify, therefore, the patients under investigation because they are potential COVID positive. And the contacts of COVID positive, that's not contract, contacts, and test them and isolate to stop community transmission of the virus. Next slide. So this is our very simple organizational structure. It was conceptualized because this is not a health facility. We were telling people, this facility is more like a dormitory for PUIs, for COVID positive cases that cannot do home quarantine. So although we need medical staff, there won't be any medical procedures in this facility. Most of the patients will be separated from the staff, and they will be assigned, if they are PUI, individual rooms. But once they have tested positive, they will be cohorted or grouped together according to gender, male, female, and they will occupy a ward setup, not individual rooms. So there will be at least one doctor on duty, several nurses, but mostly aides and utility workers. Next slide. So the protocol in these facilities would be to isolate the COVID positive. So for mild or asymptomatic patients, they will be isolated in what we call the MCIF, or the Mild COVID Isolation Facility. But for moderate and severe symptoms, and we already have an algorithm for that, they will be referred to the hospital. Basically, PGH, Lung Center, and the Jose and Rodriguez Hospital. And because the longest incubation period is 12 days, so we're following the recommended isolation of 14 days for all COVID positive patients. So from the time they are diagnosed to be positive, we count 14 days. So if they come to us on day 2, then we will release them on day 12. Okay, so it's 14 days maximum. And they have to be asymptomatic when we release them. Okay, we don't need to do test as swab before releasing them, but we're still trying to arrange with the Quezon City CESO if we swab all of them so that we'll have a documentation, but even if their test results don't come out, they will be released. But the vulnerable, those who are 60 and above, and those with pre-existing comorbidity or immunocompromised will be accepted, but we will triage. Okay, if their comorbidities are not controlled, like for example, diabetes or asthma or hypertension, then the mild patients or asymptomatic patients will still be referred to the hospital. Okay, so COVID positive must not roam around, but what if you are asymptomatic? Anyway, for those that we really detect as PUI, we will isolate them. And the facility will not entertain walk-in patients because we will not be doing any swabbing in the facility. So all the patients referred to the facility will be referred by phone call from the CESO, from the City Epidemiology Surveillance Unit. So they were already swabbed in the city or health office or the hospital, and then they are referred to us because they are not eligible for home quarantine or yes. Or if they are PUIs awaiting results of their test, they can be referred to the MCIF. Okay, next slide. So the precaution upon entry through the gate, there will be standard procedures like thermal scanning, because for the febrile, we will observe the patient. If the fever goes down or is controlled, then we can admit the patient. But if the fever continues, then we have to refer that patient to the hospital. All patients will be given masks at the gate to be worn at all times, and they will receive a kit, a personal patient kit, of which will include an alcohol bottle or a hand sanitizer that we will instruct the patients while in the triage area, while in the holding area, they will have to use every hour. Okay, no touch policy will be implemented, meaning no personnel, staff will touch the patient, and the patient will not touch any personnel in the hospital. And social distancing will be observed. So 1 meter apart. Even in the interview, the doctor will not be in front of the patient, but a table will be set up and the doctor is at least 1 meter away from the patient. And we will not ask the patient to write anything. Everything will be written by the staff para hindi pinapasa-pasa yung ballpen. Okay? And frequent hand washing or sanitizing will be done. Now, there will be 3 tags. A red tag on the referral slip of the patient means the patient is COVID positive and will be directed to the ward. The positive patient will no longer go through the triage area. Excuse me. A white tag if the patient is afebrile. So there is a triage tent for that. And a yellow tag if the patient is febrile. Excuse me. Okay, so they will be separated in 2 tents, the febrile and afebrile. Next slide. So basically, this was crudely made by yours truly because I don't really know how to do an algorithm, but basically, this was what I mentioned. We have tent 1 for the febrile patient that is located close to the triage tent. And there will be 2 triage tents. The one for without comorbidity, and the other one with comorbidity. In the tent with comorbidity, we will be doing baseline laboratories such as blood examination for diabetes, triglycerides, and for kidney disease, BU and creatinine. for X-ray will be done for all patients with comorbidity. And then we will also do an ECG for all patients with comorbidity. So that if they are with controlled comorbidities, asymptomatic and mild, and even if they are more than 60 years old, they will be admitted to the PUI waiting tent. It's a tent, no? Supplied by the Red Cross. It's air conditioned. So they will stay there for a maximum of 72 hours. But hopefully, if we get the tests early, 24 hours lang. Then they will be admitted to the COVID ward B. We will not mix the comorbid and the non-comorbid uh, COVID positive. So one floor will be for comorbid cases. The second floor will be for non-comorbid cases. Okay? If their comorbidity is uncontrolled, we send them to the referral hospital. If the fever is not resolved, we send them to the referral hospital. Okay? Next slide. I will not touch on this, but basically this is the algorithm that we use for PUIs and who will be admitted to the referral hospital or not, the mild, moderate, and severe. Next slide. Anyway, you can review it. So in summary, the SOPs are as such. No touch policy. Nobody will touch anybody in this facility. Masks will be worn at all times by the patients. But once they are in the ward or in their private room, they can remove their mask. Okay, but the staff will wear masks at all times. Social distancing, even if they are in the ward, even if they are all COVID positive in the ward, they will be observing social distancing. Frequent sanitizing and hand washing, cough and sneeze hygiene at all times. So those are basic SOPs. In the wards, the staff will not enter the patient area. Everything will be delivered to the door of the ward or the door of the patient room. It will be placed on a table or a chair, and if the food is delivered, it will be placed there in boxes, no? Disposable lahat. Walang hinuhugasan na plato, baso, or anything. On entry, we will give them the fork and spoon and the glass or the water container, refillable. So they have water dispensers in all the wards. Okay, and then when the meal is ready, we will ring the bell. They will wait 1 to 2 minutes before they open the door and get the food in. Okay. After that, they put all the refuse in a black bag, and at the end of the day, they place the black bag outside the door, and somebody will collect the refuse. Okay. Thermal scanning and vital signs will be done twice a day, 8 a.m. and 8 p.m. So that patients will have their own thermometers. If not, then we have the thermal scan, but no touch. Okay, so the patient will stand in front of their door or on the ward door, and then we do thermal scanning. Okay, next. Oh yes, all utensils are disposable. Hindi, kasi we want to be environmentally friendly. So we will give them their own spoon and fork. So yun yung they use that They clean that, they wash that by themselves. So all patients, because they're not sick, are well, they do their own cleaning. They do their own linen change. We will leave the linen outside the door. They change their linen. They collect it in a yellow bag, put it outside the door at the end of the day. So if they shower, their clothes will be washed for them, but they have to leave it in a yellow bag outside the ward door. Okay? Doctors and nurses and other staff shall be wearing PPEs at all times, except the administration building and in their quarters. All staff will be provided quarters inside the QI compound. Nobody is going home for the duration of the 14 days of the patient. And then after their duty, straight 14 days, they will be off duty, but they will stay in the QI grounds on quarantine. They will no longer be dealing with the patients, but they will stay in the grounds. They will only be released if asymptomatic after another 14 days. If they become symptomatic, we will send them for swabbing and they will join the ward for COVID positive patients. Okay, next slide. So I think that's about it. We have a dashboard. We have this data entered into our IT system, and every day we can collect all the data from all the MCIF, the mild COVID isolation facilities. So we're expecting more of these facilities than there are hospitals because 81% are mild or asymptomatic. Next slide. Okay, I won't mention this. So we know that pandemics will happen in the future. This is not the first time. So we learn from this experience. Next slide. And the worst pandemic was the Spanish flu in 1918. Now, well, we hope it doesn't go that fast for the COVID. Next slide. And we tell people not to be afraid. There are deadlier diseases around. SARS, MERS-CoV, and Ebola. The seasonal flu is deadlier than COVID. Next slide. So thank you for listening. We can defeat COVID-19. Filipinos are very resilient. Pray and stay safe. Thank you.
Right. Thank you very much, Secretary Pao, on that presentation. May we just remind everyone about for the open forum that for those who want to say something, kindly raise your hand. If you go to your chat to the participants, and then there's a button on the lower right that says raise hand. And for those others who doesn't want to speak but want to ask some questions, you can type your questions in the chat room and we will recognize you. Okay. Who wants to go first? Wala pa. So,
Okay.
siguro ako na lang po munang unang tatanong po, no?
Yes.
There is in your algorithm pinakita ng flow po and the facility. Meron tayong laboratory and x-rays.
Yes.
So, baka pwede pong detailed lang ng konti yung role ng x-ray and laboratory natin, ma'am. And who will...
Because, yeah, we included that because QI actually has a facility. They have inpatients for XDR and MDR. So they do x-ray, they do laboratories. So we said that because many of the hospitals might be over-swamped with the moderate and severe cases, we'll just do baseline in QI And then if their comorbidity is not controlled, then we really have to refer them to the hospital. If it's controlled, then we let them stay in QI.
Okay, so parang part ma'am ng ating initial triaging po. No?
Yes. But in other facilities, what they can do, like in the PICC, they can probably send the patients with comorbidity to a nearby hospital. And if their laboratories are controlled or their comorbidities are controlled, then they go back to PICC for the quarantine. No? But if it's uncontrolled, then they get admitted to the hospital. Okay?
Thank you, ma'am. We have a question from Paulo of RHU Quezon. And ano po niya is that says, thank you, Doctora, for the lecture. I'm currently with my BHWs. What skills do they need in order to help in a mild PIU facility?
Okay. Right now, what we tell everyone that, well, you really don't have to have a PUI, no, to practice universal precaution. What you need is to think that everybody is positive, so that you really have to observe social distancing, no touch policy, wear your mask, excuse me, and all that. So everybody, even your BHWs, must always think that other people are always positive and to have the no touch policy. Okay? Sorry.
Okay, ma'am. Psych Pao, okay lang po kayo?
Hindi kasi mahangin dito.
Opo. Psych Pao,
Okay.
clarify lang namin yung question na yun kasi it's coming from an RHU po. No? In this facility that you are setting up po, would there be a need to actually have a BHW in that facility?
Actually, we're asking NCR because most of the human resources will be coming from DOH NCR to send us BHWs to support the nurses.
Okay,
Yes.
so we are recruiting BHWs to be in the...
Oo, aid ang tawag namin, the nursing aides. So sila yung magpe-prepare ng food, sila yung dadala ng mga linen, ng mga medicines to the door of the patient. And then collect the soiled items.
Sige po. Right. We have a second question po from Neil Menjares from USC. Good afternoon, Dr. Ubial. Are there specific requirements for ventilation, like open air, negative pressure, etc. for this?
Actually, because the setup is like a house, we don't have air conditioning. It's open air. The Quezon Institute has very few rooms that are air conditioned. So most of the rooms are big windows, open air, and it's a very high ceiling facility. So it's an old building. Yeah, but you can have air conditioning if you want.
Is there a need for a negative pressure room for this kind of
facility? No, we don't think so because as mentioned by the experts and scientists, COVID is not airborne. It is by droplet infection and indirect contact. So you touch the surfaces that the droplet falls on, then you get COVID. So it's not negative pressure. You don't need negative pressure for isolation. You don't need air conditioning for isolation.
Sige. Dr. Michael Campoy is raising his hand. Please.
Hi, thank
Hi.
you. Thank you, Sec Pao, for that presentation. So, yung tatanong ko lang po, kasi tinitingnan natin to, this seems to be one of the forwarded solutions to expand the hospital capacity, no po?
Yes.
And what we're now looking at is the fact that we don't want our hospitals to kind of like fall down or masira yung kanilang service capacities dahil sobrang overburdened sila. Pero nandun din yung part na we also have to look at that the communities have to be the first line of defense. And parte dito is we have to ration the healthcare workers properly so that we don't leave any part unmanned or no one, parang hindi lang siya, naiiwang bukas. So, yung tatao dito sa facility na to, two questions. What would be our decision criteria whether this type of facility can be feasible in a locality or LGU or region? And number two, how are we going to ration the human resource, especially if we're gonna borrow BHWs for its operations?
Yes, basically, as I mentioned, no medical procedures will be done in this facility except yung baseline laboratories and X-ray, but that's an optional thing. It's mainly a dormitory and observing really infection control procedures. So we just have 1 or 2 doctors on duty, and the rest of the staff will be nurses and nursing aides and utility. So it's just like running a dormitory, but you're actually not mingling with the occupants.
So just to follow up lang po doon, kasi yung even the nurses po and also yung mga dietitians and all those people are still gonna be taken out from somewhere, di ba po? So, alin po yung, paano natin kaya ibabalance na walang mabablangkong pasilidad o kaya frontline area?
Oo.
How yung tanong po ni Dr. Mike's, no? Kasi tinitignan po natin yung model learnings from setting up the QI if it is possible to be adapted by the other LGUs. I think the question po, from your experience in QI po, parang saan po natin kukunin yung ating mga doktor at nurses?
Well, right now, ang kinuha naming staff are from the offices. Sila yung mga nurses and doctors ng regional office ng NCR. So it's very thin on health personnel. Most of the other personnel that will be working there are basically the unemployed people in the community. We give them employment. We provide them salary, and we provide them all the food requirements and accommodations for the next 14 days and during the quarantine. So it's heavy on, shall we say, volunteers, but they will be paid volunteers.
Ma'am, I think related to that, nabanggit niyo po yung food, no? There's a question from Dr. Jonah Mandak. No? When it comes to the options for food, hygiene kits, and laundry for the PUIs while they are in the facility, how will this be sourced out po?
What? I didn't hear that.
Food po, yung hygiene kits, and then yung laundry services po for the facility. Paano po i-address to or source out po ba to?
Yes, we're sourcing it out to the regular hospital parang providers. So the hospital that is closest to the Quezon Institute is the National Children's Hospital about 500 meters away. So whoever is servicing them will service this particular facility. But in my concept, no, as soon as you can actually sterilize all the linens, all the clothes of the residents or the patients by putting them in a pail of water and detergent soap. So once it's there, it's no longer infectious. So you can use actually any regular um, laundry machine or washing machine or hire people to do your laundry basically. Just make sure that when the patients bring out their soiled linen and clothes, it's soaked in detergent and water.
Sige, ma'am. I think i-clarify lang natin, ma'am, so that will be sourced out rin yung laundry po, no?
Yes, for our institution. Kasi
Saying,
marami sila. We're thinking of 100 to 150 patients.
Yeah.
And our staff would be around 36 to 40 staff.
Right. Sige po. Ma'am, there's a question from Yan Isaac from Davao. Yeah.
Hi, Doc Pao. Good
Yes.
afternoon. Thank you for that great lecture. Doc, actually, I have a concern. Since here in Davao, we're gonna start with our ECQ as well, and we've actually operationalized our own PUI facilities po, Doc.
Mhm.
And ngayon po kasi nangangapa po kami talaga po sa mga PUI facilities since, well, nagbaba naman po ng guidelines ng POH, pero syempre, of course, these are makeshift facilities po
Yes.
kasi, Doc. So,
Oo.
medyo, ano po siya, mga gym, mga hinge. Tapos, Doc, yung concern ko po kasi is, currently, we're only admitting mga PUIs po na mild to these facilities. But as per your lecture earlier po, you're actually admitting also yung mga mild COVID cases.
Yes, that's right.
Also, sa mga mild COVID, as clustered,
Positive
as
na
long
sila.
as clustered po sila, kumbaga.
Yes.
Okay, okay.
Actually,
So, okay lang po yan,
yung
Doc,
mga
na in the same
PUI,
facility sila.
yung mga PUI, we don't cluster them, we don't cohort them. They're in individual rooms. Yung mga positive na, they're cohorted. Pwede na silang sama-sama.
Okay. Kasi, Doc, yung sa guidelines po na binaba ng POH, as long as may distancing or may curtain at least 3 feet away from each other, yun po kasi yung sa guidelines namin. Pero, so, okay lang po na i-cluster basta positive po. And then for the PUI, separate rooms sila, kumbaga.
Kasi we don't know if they're positive or negative, yung mga PUIs. Pero yung COVID, we think that it's healthier for their mental health to be together with other patients, and there's no actually danger anymore of spreading the virus. So we think that it's better to really group them into a ward setup where they can socialize or interact with other patients.
Okay. Sige, Doc. Tapos may follow-up question pa po, Doc. Since we're already operationalizing our PUI facilities po, Doc, with regards to the protocol, for example, for a PUI patient, bumalik po na negative po ang results niya, syempre need pa rin na i-finish niya yung 14-day quarantine. Pero sa ngayon po kasi, Doc, we're thinking na baka mag-overcrowd na yung mga PUI facilities namin. So, kumbaga, the PUI facilities are keeping patients na nag-negative na, pero they're only there for finishing their quarantine. So, we're thinking kung negative na po ang PUIs, is it okay to send them home on strict home quarantine, tapos i-refer sila sa BHERT, kumbaga, Doc? Kasi nag-overflow na po yung
Yes.
mga PUI facilities namin, Doc. And then, syempre may mga nag-negative, may nagpa-positive, tapos nagsasama-sama sila in one facility.
Yes.
So we're thinking na, kung nag-negative ka na, baka pwedeng mag-home quarantine ka na lang mag-finish ng 14-day quarantine. So, Doc, what are your thoughts on that, Doc?
Yeah, in our protocol, if they're negative, we send them home. Negative, asymptomatic dapat. Pero if
Yes, Doc.
they're negative with mild symptoms, we keep them. Pero asymptomatic, we send them home.
Okay.
Okay.
Okay. So, Doc, hindi na necessarily kailangan tapusin yung 14-day quarantine. Basta, what do you call this, negative results and
Yes.
asymptomatic
Oo.
po. So, okay, alright. Kasi we're sticking to the protocol po of 14 days po talaga.
There's no scientific basis why they should be kept on quarantine
Yes,
when they're
Doc.
negative.
Okay. Alright. Sige po, Doc. Yun lang po kasi nahihirapan kami since we're still keeping po the patients na nag-negative na.
Yes.
So, it really helps na we decongest also our PUI facilities.
Oh, yes. Oo. Kasi if you keep them, baka maging positive na rin sila in the end.
Yun nga po, Doc.
You send them home. If they're negative, send them home.
Yes
Right.
po, Doc. Alright. Thank you
Yan,
so
yes,
much
for that.
po.
For that.
Thank you.
Right.
Okay.
Doc Pao, balik lang ako doon. Kanina nabanggit nyo, it's very good that you actually talked about social people. Filipinos are actually sociable individuals, no, as a society. Segue to Dr. Lester's question po that how do we actually ensure the quality of life of these people while in the facilities? So, meron po ba tayong pinag-uusapan na activities na allowed while inside the facility? Meron po bang
Yes.
like TV, books, magazine?
Yes, we're thinking of putting up a schedule, like something like daily exercises in the morning, mass, no, and then teach them a few skills like origami or something interesting, painting, or something. So, parang nag-iisip na kami na every day, there has to be a schedule for them. Then, we're also giving them some, we have Wi-Fi in the facility because we feel that many of them would be able to interact with their relatives and friends through the internet. And then we also, but the concept there is that once we allow them to bring their books or bring their materials that will keep them occupied, kung meron silang radio or music, you know, or they have playing cards or even board games, no? But everything that COVID positive patients will bring into the ward will not leave the ward until the patient leaves. So, dadalhin niya yung mga pinasok niya sa loob ng room. And once he is about to leave, we will instruct him how to disinfect those items.
Right. Thank you for that talk, Paolo. Tuturuan natin kung paano uli bumalik ng 90s.
Yes. Oo, meron silang mga Scrabble, whatever, board games.
The next question is coming from Jakey from Medicines Dumont po, no? And he says, he's asking, good afternoon and thank you for the lecture. I want to ask what will be the protocol for very small children or infants who still need a caregiver? So, meron po ba part natin na i-admit natin ang kung children? Meron po ba sa ganun?
At this point in time, we have not had any patients referred who are children, but I think if we do have children, there's the nearby National Children's Hospital, so we will have to refer the children to that hospital.
But are we testing in children's po ba ngayon?
If they have symptoms, yes, we do test. There's an infant less than 2 years old that tested positive in Mindoro. And there's a girl that tested positive, 13 years old in Quezon City.
Okay.
Meron 16 years old sa Bangi, Abra, Ilocos Norte that tested positive and died.
Right.
So yun yung alam ko may mga children.
Okay po. The next question, ma'am, is from Neil Espino, Dr. Neil Espino from the Pangasinan Provincial Hospital. The question niya is that how can we monitor these patients? Because although their comorbidities are controlled upon admission in the facility, complications can still arise.
Yes.
So stress-induced hyperglycemia and hypertension. We are admitting patients with comorbid po, no? Tama po ba?
Yes.
Or are we? So I
We
think
are admitting patients with comorbidity, and it has to be controlled comorbidity.
so pag
We will provide them the maintenance medicines and do monitoring.
Okay. And the moment that they develop complication, they will refer to a hospital.
They will there's an ambulance on standby in the Quezon Institute. Anytime that they develop serious illness, they will be referred to the hospital.
Okay, thank you for that.
Okay.
The next question, ma'am, I think related to the human resources po from Dr. Alan Junicio from
Mm-hmm. Yes.
What sort of compensation is being given to the people who will be working in the facility?
Yes. The nurses are being paid by the NCR because they are the NDPs, no? And the doctors are actually volunteers, but we still don't know what the final compensation of DOH would be. Whereas the utility workers and the BHWs or the aides will be given minimum wage. But even if they're on quarantine, they will still be paid. So it's minimum of 28 days.
Mm-hmm.
And then we ask them to go on 2 weeks leave. They can come back for another tour of duty, another 28 days.
Okay. Thank you for that, ma'am. Yung right. Si Doc Jimmy po nagtatanong kasi sabi niya,
Yes.
Kazakhstan po. Sabi niya, kasi there's already a plan po, ma'am, of converting PICC, Rizal Memorial, Ultra, and other complexes po, no, to a PIU facility as well. So, ang tanong po niya, what will be your advice if when in such buildings are made COVID positive mild cases, or even that the PUIs or PUMs?
Yeah, that's why we're finalizing the guidelines for this MCIF, the mild COVID isolation facility, because this will now be used to guide the other facilities that are now being converted to house mild COVID cases. So yung guidelines that we are now developing for QI will be used in the other facilities.
Ma'am, i-clarify ko lang. Hindi ko alam po kung nabanggit nyo na kanina po. But for this facility, who will be the one managing it? Is it national or Quezon City? Or
no, for this facility, it's being managed by DOH Regional Office NCR.
Yeah. Okay.
So all Metro Manila hospitals can refer, or city health offices. We won't entertain walk-in patients. They are only referral from city health offices or hospitals.
All right. Thank you for that, ma'am. See. Dr. Rosalind Panao po of DJFMH. No? Good afternoon po. I would like to clarify po if ever nasa NCR po nakatira, considered as PUM na po ba? So if ever magkaroon ng symptoms like fever or cough or sore throat, are they classified na po as PUI like for pregnant women? Salamat po.
I think when we say PUM, there must be like presence of COVID positive in the community. So it depends. Kunyari sa Quezon City, not all barangays have COVID positive. Or you didn't like go near the house of the patient that is COVID positive. So not all the residents of NCR are considered PUMs.
Mm-mm. Sige.
Only those with direct contact with a COVID positive.
Mm-mm.
Diba?
Right.
And then if you develop symptoms, you become a PUI.
Mm-mm. Actually,
Okay.
feedback ko lang rin po, ma'am, when we actually talked to the Department of Health yesterday on this one, parang there's two levels when you talk about PUM, no? Within Metro Manila, yung binabanggit ni Dr. Pao, no, na sa magiging PUM ka if you have a known exposure. No? Kung alam mo, exposed ka sa isang PUI preferred case. But if you're talking about in the setting of outside Metro Manila, ang definition nila ng PUM is somebody who came from an area na merong local transmission. No? Halimbawa, ikaw ay galing pong Metro Manila.
Metro Manila.
And they consider you as a PUM.
As PUM.
Yes, ma'am. And then you would be advised and to be quarantined for 14. So may dalawang level. Mukhang may dalawang level po na.
Okay.
At least for Metro Manila po, clarify natin po yun. You will be classified as such when you have a known exposure.
Mm-hmm.
Po. Sino pa po ba? Ma'am, so we talked about kanina po, children. Ang tanong po, patungkol naman po sa pregnant women, meron po ba tayong special arrangement or consideration for pregnant?
Pregnant women will be asked to, will be referred to hospitals. Hindi pwede sa aming facility. Even if they have mild or asymptomatic COVID, they will be referred to a hospital.
Okay. Question from AJ Arcelosha from CIM CMSS. I think, ibu ba to? Tama. Tanong niya po, ma'am, sabi niya, thank you so much for the lecture, Doc. Is there a need for counseling or debriefing for the patients upon discharge from a facility? Very good question po, no? So, psychosocial.
Yes. Actually, we're organizing psychosocial activities while they are inside the facility, but it's like group counseling or activities that will be done as a group, no? But still observing the no-touch policy. The lecturer will be in the lobby and the patients will be in the wards listening. No, so even in the hospital, they will be provided with debriefing and counseling. But once they are discharged, I don't know if we can manage to have all of them undergo a debriefing or just the identified high-risk patients. So wala pa kaming standards for the discharge.
Okay, thank you po, ma'am. Meron pa ba tayong na-miss? May gusto pa hong magtanong? Meron pa. Dr. Alan Junicio po ulit.
Okay.
Again, question niya po, ma'am, is about the security plan po of the facility. No? Will there be a sergeant at arms?
Yes, there is.
To actually make sure that there is social distancing.
Yes, there is sergeant at arms. Then we have additional aside from the security guards of the Quezon Institute, we have additional forces from the military, the uniformed men, that will assist us in securing the entire facility.
From the AS.
Nobody will be allowed in the gate except for the patients and the personnel. No visitors, no other people. So, yun yung i-maintain.
Oh, how many beds nga po uli, ma'am, ang tinitignan natin?
It's good for 150 beds. But right now, we're only admitting up to 50. Kasi as we move on, we add the wards and the rooms to be furnished. Up to 150 total.
Okay. I think that's the last one on the chat group for questions. Meron po ba iba? Ito. Dagdag
Okay.
connected to the security. Will there be a CCTV?
I don't know if we can afford. Actually, the question for many of the things that we wanted to do is budget. We have very limited budget. Our in fact, budget for supplies and materials is very limited. So we won't have air conditioning in all the rooms. We'll have electric fans, industrial fans for the tents. Our budget is very limited. We don't have budget for CCTV.
Have we explored the partnerships with private institutions to support the facility?
Yes, we've accepted a lot of donations. They're donating PPEs, donating masks, hand sanitizers, things for the patients, alcohol, food, so many.
Right. Okay. Meron pa po ba last 2-3 questions? It's already.
We're getting Wi-Fi pala free, courtesy of Globe.
Wow. Okay. Masaya naman mag-Candy Crush. Okay. 6:09.
Okay.
It's 6:09 now. We're 1 hour since the time we started. All right.
Yes. Okay.
No? Tanong po ni Doc Jimmy, will QI be paid by DOH for the use of the facility?
No, it's there's a MOA and it's free. It's provided by the board of the Quezon Institute for free. But all the expenses, the electricity, the water, the food for the staff will be paid for by DOH.
Okay. Right. Right.
Okay.
Ma'am, you have any last, well, not last, of course not, but closing remarks that you want to say? Yeah.
Well, thank you for this opportunity. I hope that we really make this work for all our people. And of course, we welcome any suggestions from all of you, our partners. And we also welcome donations in the Quezon Institute. Board games, books, if you want to donate, we're most welcome to all of them. So thank you very much. And we hope that there will be more volunteers because right now we only have 4 doctors and like 12 nurses per shift. The 4 doctors will be 1 doctor per shift.
Right.
Okay, thank you.
Thank you very much.
We need the rad tech.
All right. Thank you so much for that one. No? Before we close this one, i-summarize lang siguro natin no, ang discussion. No? But very briefly, when you actually talk about setting up any facility such as this scale, no, there are several factors. We know that there are several factors that you have to consider. No? And you can actually summarize them in the 4S framework. So we'll talk about this one and look at and planning and in the scale of such endeavor. And these 4S are, first one is your space, no, or infrastructure. We have to talk about that, what it should look like, what is the most ideal setup, and for what purpose. No? The second S would be your staff, you know, or your human resources, which is, I think, one of our biggest challenges, right? Not
Challenges,
only
yes.
UI, but the whole country and even actually the whole world. No,
World.
so we have to be very rational in terms of how we use our human resources. The third S is your stuff, STUFF, or supplies. No, very important right now. Pinag-uusapan lagi ang PPE. Again, rational use of those resources as well. And then your fourth S would be your special services. You cannot run such a big facility or institute without talking about your support services, no, and other special services. When you talk about psychosocial services, talk about in terms of how do you feed them, you know, food, and also how you actually manage the logistics, and so on and so forth. So, it's quite a big endeavor to enter SecPao, and we wish
Yes.
good luck on this one, and we
Thank you.
looking forward to learning from your um, success and also the challenges that we could address.
Yes. Maybe we can have a follow-up
Yes, ma'am. Yes,
conference.
I think the in the next series of lectures for PSPHP, there will be one to two sessions that will be looking at the lessons learned in the past initiatives already. So we could be learned, and
Okay.
more people will be able to adapt and learn from them po. With that, maraming salamat po.
Thank you.
Slides will be shared in PDF form via email, and it will also be available in the resources. No, I think GR will show us kung saan ang mga links for this. Again, maraming salamat po.
Okay. Thank you.
Over
Hello
to you.
po.